Chapter 7. Ergoptics. Janice had suffered headaches her whole life, but in her 20s, when she started working on a computer all day, they got even worse. Sometimes she'd have 2 or 3 headaches a week, sometimes she'd have one every single day. These headaches were migraines, often accompanied by visual disturbances called auras. It was like trying to focus through rippling water, she says. Sometimes she got an aura, or a cluster of them, all on their own, without the pain. They were bad enough to make me pull over when driving, she recalls. She took to always wearing sunglasses. She learned to recognize her triggers. Patterns of light and dark were particularly bad. Window blinds, for instance, or trees casting shadows on the side of the road. For years, she took medication to control the headaches, but the drugs were expensive, about $20 a pill, and she didn't always have insurance. When her daughter started doing vision therapy, Janice noticed an irritating diagram of black and white stripes displayed in the office. She actively avoided looking at it. I would shield it from my view every time I walked in. If I looked at it, it was a full-blown migraine in 15 minutes, she says. As far as she was concerned, she had learned to cope with her problem. But towards the end of her daughter's treatment, Janice agreed to be assessed herself. To her surprise, after changes were made to her lenses, the headaches disappeared. I haven't had an aura or migraine since. I've used no meds, nothing, in over a year. She no longer lives behind sunglasses or hides from patterns of light and dark. With a single appointment, she says, 30 years of migraines were suddenly over. Janice is Chelsea's mom. You met Chelsea in Chapter 1. I remember how she used to come into the office and protect herself from the pattern glare test grid. It's really just a picture of alternating black and white stripes, but her reaction to it was a big clue that I could do something to help her. If just looking at a pattern of dark and light gives you a headache, something about the act of seeing must have a hand in bringing on that headache. I was able to help Janice simply by changing her lenses. She'd been prescribed lenses that allowed her to see clearly, but they were causing a mismatch between her visual and vestibular systems, impairing how her eyes work together and causing eye strain. She was over-focusing, so at first it felt like I took away some of the distance acuity. She's still 20/20, meaning she can see all the letters she's supposed to at 20 feet away, but her vision is not as super crisp in the very far distance as it was. I also added a bit of Prism and altered where the center of the lens was. Her vision did get to better clarity once her eyes started to relax. The point of all this tinkering was to make the whole system work better. I wanted her visual system and vestibular system to align better, and I wanted her eyes to team and track better. I believed this would help resolve her headaches, and I was right. Janice is a perfect example of how lenses can solve problems. She's also a perfect example of how they can create problems. Simply by altering the way light was coming into her eyes with lenses, I was able to dramatically reduce her headaches. The brain uses the information that comes in through the eyes to help it formulate ideas about depth and space. That, in turn, helps it figure out how to move the eyes in order to track properly. You can't move your eyes to a point in space without first calculating where they need to go. The brain has its own established equations for how to do this. Much of what you've read in this book so far has been about the therapy I do to get the brain to properly use what comes in, tweaking its equations, so to speak. But sometimes, the solution, or at least part of the solution, is to physically alter what the inputs are. I call this ergoptics, ergonomic prescribing. I carefully alter the incoming information to improve how well a person can function visually. Sometimes it means figuring out how to alter inputs so they line up better with what the vestibular system is perceiving so that you don't get dizzy. Sometimes it means altering the inputs so that the eyes can work together better when reading. Sometimes it means altering what comes in to help the eyes do a better job of following a moving object. It's a style of prescribing glasses that is different from what you might be used to. Probably most of your glasses have been prescribed for clarity, to see clearly. My aim is to prescribe the glasses that will help you see more efficiently. Sure, I want you to see clearly too, but I want to do more than that. I want to give you the most efficient visual function possible. The lenses I prescribe act as sort of an intermediary between the external environment and your brain, and is kind of a supplement to the original intermediary of your own eyes. Whereas therapy tries to change the equation inside the brain, Ergoptics changes the equation before it gets there. Same goal, different points of intervention. There are 3 main things I want to tell you about lenses. The first is that there are a ton of things optometrists can do with them. We optometrists are masters of the eyeglass, and we can do much more than just make your vision sharper. The second is that most optometrists don't use these superpowers. Either they don't bother or haven't been trained how to do so. The third is that getting the lenses right is vitally important. Let's start with what we were able to do, or at least should be able to do. Like your eye's own lenses, prescribed lenses change how light bends. Corrective lenses are just a piece of glass or hard plastic, but depending on how they're made, they will alter the light differently. That's important because the information conveyed in this light is what your brain uses for depth perception, hand-eye coordination, integrating with the vestibular system, calculating movements for eye tracking, and coordinating the two eyes, among other things. Here's a secret you may not know. Lenses are more than just the prescription you hold in your hand. How that prescription is actually configured can completely alter how effective it is. Labs often make their own adjustments or have their own lens designs. The same prescription can turn out many different ways. I take an active interest in how they are configured. As an example, let's take the progressive lens, which can seem like having 3 prescriptions together in one piece of glass or plastic. But that lens actually features a graduating blend as it changes from top to bottom. The top part for distance, the bottom for reading, and a narrow strip down the middle for the mid-range. These lenses often have some distortion in the periphery, which can cause dizziness and nausea in some people and can make it difficult to adapt. Even worse, if you're a person who works at a computer, you're spending most of your workday straining to see that through that narrow strip of correction in the middle, which is almost never the correct prescription for seeing what's on your computer screen. It also makes you tilt your head backwards. In my opinion, there isn't a single person routinely using a desktop computer who should be wearing progressives for work. I just don't understand this obsession we have with jack-of-all-trades glasses. You have multiple coats. A coat you wear in the rain, a coat you wear in the cold, a coat you wear when you step out of the shower. You have multiple shoes for running, for working, for wining and dining. Imagine how much of a compromise it would be if one shoe had to do everything. I don't know why people think glasses should be any different. They aren't. And people are paying the price, not only in poorly corrected vision, but in extra headaches, lost work, dizziness, and distraction. But even if you do decide on a pair of dedicated computer glasses, you still have to be on guard. Most of the time, they are created from a generic calculation deduced from your distance in reading prescriptions. But how far is your computer from you actually? Did anyone ask you? What you really need is a lens based very specifically on your own work setup and your own visual system and how your eyes work at that distance. And those are the easy cases. Often the problems go well beyond needing to see clearly. Sometimes a person is seeing blurred, or in extreme cases, doubled images due to binocular vision dysfunction, and the right lenses can often be a part of fixing that. There are a number of tools in my toolbox to help with complex issues like these. Earlier, we talked about blending different prescriptions. Manipulating the prescriptions by strengthening them, weakening them, or combining them carefully is one of the tools I can use to make the eyes work more efficiently. Another is prisms. Prisms are really just wedges within a lens, are used to shift light or to help with a misaligned eye. However, prisms also change your depth perception. Sometimes, especially with progressive lenses, the way the lens is made can result in a prism being added without being prescribed and with unintended results. In fact, I had a patient who experienced both dizziness and balance issues so severe she would fall off of her horse. Then we discovered a prism had automatically been added to her progressive lenses. Once it was fixed, so was her dizziness. In my office, as I mentioned earlier, I sometimes pull out my special prism goggles. In some cases, these goggles of empathy are used to help parents or caregivers experience what their loved ones are seeing. I do this by deliberately distorting things with the prisms. In other cases, they're to check if I can solve a problem using prisms to adjust the inputs. In both instances, I'm essentially inserting a new equation between the external environment and the brain. You'll remember Todd from Chapter 4. I prescribed glasses for him because, when I put the correct prism lenses on him, he wasn't seeing double anymore. He'd had major double vision and headaches. He couldn't read when I met him. He was skipping lines and losing his place. The glasses helped with all of this and made it possible for him to start on vision therapy. Yet another tool is occlusion, where I put little pieces of tape on the glasses. When I put a piece of tape on just one side of the nose, I can change how a person perceives the midline. That is, what's straight ahead of them. When I place it correctly on both sides of the lens near the nose, it's called Bi-nasal occlusion. I spoke about this in Chapter 5. Doing this correctly can reduce symptoms like dizziness, nausea, and headaches by changing how the binocular fields overlap. Let me say a word about a tool I use sometimes but not often. Color-tinted filters. Undoubtedly, they help some people with symptoms. I'm not a fan of permanent filters because people can habituate to them. And my clinical experience bears out the research, which has found that the underlying issues are the very ones we've talked about in this book. So, given the choice, I'd rather get to the root problem and solve it, the way we set a broken arm, rather than just medicating it with Tylenol. Maybe it's the engineer nerd in me, but in my opinion, this stuff is critically important. I have an entire practice in Brooklyn, New York, based on getting prescriptions and lenses just so, because my clients there understand how important that is. I myself wear reading and computer glasses, even though my clarity needs no correction. For me, it's about work efficiency. I went through school reading several pages at a time, then changing tasks and coming back. Now, I can sit and read entire books. Again, if you're the kind of person who recognizes the need for specialized footwear, ask yourself why you don't care as much about your eyes as you do about your knees and feet. This chapter started with Janice and her headaches. I had another patient around age 60 who'd been taking migraine medication for over 20 years. In the 2 years since I changed his lenses, he hasn't had a single migraine. Headaches are a real red flag for me. I mentioned the pattern glare test. If you suffer chronic headaches and looking at this pattern really bothers you, if it makes you think it will bring on a headache, makes you nauseated, makes you uncomfortable, that tells me, clinically, that a huge proportion of your headache trigger is coming from visual stimuli. Again, all you are doing is looking at a simple static image. You can see this image by going to our website and searching for pattern glare, or visiting www.isitvision.com. You briefly met Jared's mom, Kendra, in Chapter 2. It was while Kendra was bringing Jared in for treatment that I heard her routinely complain about headaches. She blamed the computer and the bright lights in her office. I told her flat out that she shouldn't be getting so many headaches from that. This modern world of close-up work is a challenge for many of us. Truth is, humans didn't evolve to spend so much time this way. Lenses can help to reduce the negative effects of this unnatural vision strain. Kendra had never worn glasses, but I asked if she would just let me check her eyes. I found that her eyes really strained to work up close. I prescribed glasses that she could wear at her desk and while reading. With the new prescription, the chronic headaches went away. And it wasn't just the chronic headaches. She also stopped making embarrassing mistakes in her reports, like forgetting to type a period at the end of a sentence or getting the file number wrong, things she couldn't always process before. I'd struggled with academics all my life, Kendra says. I felt stupid. I had low self-esteem. Now that the headaches had stopped and she could see better, she found she was performing better too. She applied for a promotion from bail supervisor to probation officer. I never would have gone for it, she says. But after her vision issues were resolved, she says she had more confidence in herself. Ergoptics uses lenses to change the light information coming through the eyes so that the brain can use it effectively instead of being confused by it. What I want for my patients is the best visual efficiency possible so that they can have the best possible quality of life. And by the way, she got the job.